Anyway, I'm Dan Klein with the PAN Foundation, and I want to welcome you all here this morning. Before I get started, I also want to thank you for making time to come this morning, and I want to strongly encourage you to participate throughout the day. There'll be lots of opportunity for you to contribute, ask questions, join the conversation. Of course, I also want to thank our partner, the American Journal of Managed Care, and our great sponsors for making the roundtable today possible. And I really want to give a thanks to Amy Niles for once again organizing the roundtable and for getting us all here this morning. I think most of you know that the primary mission of the PAN Foundation is to provide financial assistance to underinsured patients so that they are able to get access to their critical medications. And equally important, but somewhat less well-known part of our mission is to be an advocate for affordability and for improved access to treatment. And that's really what the roundtable is all about today, to encourage all of us to think about and get out there and do what we can to make sure that patients are able to get access to the care they need. Over the past 2 years, the PAN Foundation has provided over $1.7 billion in assistance to patients who've needed help getting access to their treatment. We've helped over 500,000 patients. And maintaining that level of support is growing increasingly challenging in today's uncertain environment. In talking to folks out front before we got started today, the one word that kept emerging in everybody's conversation was uncertainty. And it's affecting all aspects of what we do. We don't know when we get up in the morning whether we're going to be talking about repeal, replace, or now repair. We're not quite sure what's going on with Medicare or Medicaid. But as I tell myself, and I think I'm probably starting to tell some of you, the one thing we do know absolutely for sure is that the need for the safety net is growing. So I think it's very timely for us to be here today talking about that. Despite the seemingly large numbers that PAN can point to in terms of the numbers of people we help and have helped over the past years, we're a tiny part of the safety net, and we need to keep that in mind. That when I talk about the safety net, I'm referring to all of the various charitable assistance programs, and they go from church-based programs in local communities all the way up to big programs like PAN and the other OIG-approved charitable assistance programs that some of you are familiar with. And they include manufacturer-sponsored programs. We absolutely can't ignore the fact that many of the drug manufacturers operate significant patient assistance programs and free drug programs. In total, all of these assistance programs help people with their out-of-pocket costs. They help with paying for insurance premiums. They help pay travel-related expenses. And many provide free medications as well. And more free medication programs, which originally were intended for people who didn't have insurance, are now being extended to people who are underinsured. Just considering Medicare Part D, there are about 16 million people who fall between 150% and 400% of the federal poverty level. So that's a group who are their income is too high to qualify them for the low-income subsidy, but many that fall in that range are unable to afford their critical medications without some form of assistance. And that number is growing. So why are we here today? Why is there a sense of urgency? And I think, again, from talking with folks before getting started today, I definitely feel that there's a sense of urgency. Most of us recognize that the need for the safety net is growing, and it's going to grow quite a bit more in the next few years. Medicare is going to grow from around 57 million people today to over 70 million folks in the next few years. The likelihood of cutbacks in the Affordable Care Act is going to affect people of all ages, not just seniors. The possibility of significant changes in Medicaid, whether it's a block grant or Medicare, whether it's a voucher. And of course, you know, we're seeing continuing increases in the cost of treatment. So all of those factors are driving the need for the safety net. And I should say other solutions as well. The safety net isn't the answer. It's a temporary fix, if you will. So we need to look longer term at things like value-based insurance design and other creative solutions. But today we need to be, I think, pragmatic as well as compassionate. And we need to recognize that at least in the short term, the safety net is critical. So we want to encourage all of you today to really think about different strategies for helping us maintain the safety net while still looking to the future to get to a point in time where we maybe don't need a safety net. So with that, I'd like to introduce our co-sponsor of the roundtable. Today we're lucky to have Jeff Prescott with us. Jeff is a pharmacist by training and Senior Vice President of Managed Care for Michael J. Hennessy Associates, the publisher of the American Journal of Managed Care. Jeff has extensive experience in health economics and health informatics. And I have heard that in his spare time, he is still a community pharmacist. So Jeff, let me welcome you up here to say a few words.